All right. So now we're going to be talking about antipsychotics. Psychosis, it's a mental condition characterized by disturbed thought processes, delusions, and hallucinations. Schizophrenia is a type of psychosis. It's a pretty common type of psychosis. Characterized by bizarre behaviors, things where you're like, wow, that's just weird, right? Some hallucinations, both visual and audio. Lack of motivation and or emotion. And so they seem very apathetic. This involves some genetic defects, especially with excessive dopamine and serotonin. And so all your antipsychotic drugs are going to try to bring down dopamine and serotonin. On the flip side of that is anxiety. Anxiety and kind of depression, both with this other side of it. Anxiety, really common, seems to be getting more and more common as we put more and more pressure on ourselves to achieve life, right? And so anxiety, it's just this uncertainty or fear about a life event or a life circumstance that's going on. Lots of different types of anxiety, like general anxiety disorder, panic disorders, obsessive compulsive disorders, post-traumatic stress disorders. All this involves stimulation of your sympathetic autonomic nervous system, which causes hyperarousal of the cerebral cortex and can set off your body's fight and flight mechanisms. So with our antipsychotics, we're going to see them blocking dopamine receptors, because that seems to be one that is really important in the whole psychoses. Blocking dopamine can cause extrapyramidal syndrome, EPS. It looks kind of like Parkinson's or Parkinsonian-like symptoms, with like the shaking hands and ataxia. We also see that serotonin is linked with psychotic behaviors, and a lot of your antipsychotics will be blocking your dopamine 2 and your 2A serotonin receptors. We have 4 classes of antipsychotics. You have your phenothiazine, your butyrophenone, and your thioxanthines, and then your atypicals. So these 3 are called typical antipsychotics because we see them blocking mainly this D2 receptor, and all 3 of them come with a higher incidence of EPS. Your atypicals, though, are going to take a little bit of a different route, which we'll talk about. So, with a lot of these drugs, we're also going to see so you're going to have your antipsychotics blocking the D2s, right? And then also blocking your serotonin. These ones are going to have lower incidence of EPS on the serotonin. D2 is going to give you the higher EPS, because something that we see in Parkinson's is a decrease in dopamine, and to treat it, we're going to give dopamine. Something else that we see with these antipsychotics is you're going to have a lot of, or some, anticholinergic effects, at least in some of them. You're also going to see postural hypotension. So when you change from seated to standing, your blood pressure is going to drop, and you might get that tunnel vision. And then you'll see some sedation, some antihistaminic effects, so blocking histamine. So in our first group, our phenothiazines, you see we have thorazine here. Pretty low potency when it comes to treating schizophrenia, but it does give high sedation. And so this is going to be really good in individuals that are very anxious, excited, manic even. And really, like, thorazine was the first of the antipsychotics to be discovered and to be used back in the 1950s, and it really just revolutionized mental health care. A lot of people who were institutionalized could be sent home on this drug and be able to live like normal lives. It doesn't cure the psychosis, but it does help to control it, right? A lot of the side effects: dry mouth, constipation, visual disturbances, sedation. That's due to the anticholinergic and the antihistamitic effects. Dystonic reactions. Dystonic just refers to like muscle spasms, twitching, facial grimaces, torticollis, which is a twisting of the neck. Sometimes that's seen pretty commonly in infants that have muscle issues. It can also cause akathisia, tardive dyskinesia. Tardive dyskinesia is a little more severe or worrisome. It's involuntary movement of the lips, jaw, tongues, extremities. And this happens after somebody's been on the drug for a while, and then they come off of it. So they get that tardive dyskinesia. And then even more worrisome is neuroleptic malignant syndrome. This is potentially fatal, comes with hyperthermia, muscle rigidity, catatonia. So catatonia is where they're just like frozen and they can't move. If someone starts getting neuroleptic malignant syndrome, you have to stop the drug like immediately. Your butyrophenones, Haldol is the go-to for this. It is more potent, so you see it has a very high potency. Low sedation, but really high risk of EPS too. Low anti-cholinergic, low postural hypotension. This is really used in a lot of your agitated manic patients too. It also suppresses motor tics and vocalations that you would see in Tourette syndrome, but again, also gives a very high incidence of EPS. Thiothixine is your go-to thiazanthines. Again, really high incidence of EPS. Generally less sedation, less anticholinergic effects. You can see kind of medium on the anticholinergics. Low postural hypotension, middle sedation. And then our atypicals. Some of these you may have heard of, like Abilify, where it has a high potency, low sedation, low EPS, low AC, low pH. Clozapine is another one. We'll just go through some of these. What is it? Risperdal. So with Abilify, it's one of the newer ones. It is an antagonist of your dopamine and your serotonin receptors. Really high potency, low sedation, low EPS, low metabolic disturbances. It really is a pretty solid antipsychotic. Can cause dizziness, headache, constipation, anxiety, and sleep disturbances, but most of these can. Clozapine, moderate potency, still low EPS, higher sedation, risk of seizures, weight gain, and agranulocytosis. Agranulocytosis is a decrease in your agranulocytes, so you have less lymphocytes, less monocytes in your blood, which can lead to an increased infection risk. Postural hypertension is pretty prominent. The anticholinergic effects are pretty prominent. So normally the other atypicals are preferred. Zyprexa, high potency, low EPS, really good at treating acute mania and bipolar disorders. So it helps to stop the manic side of bipolar. does cause dizziness, sedation, weight gain, postural hypotension. Stuff you kind of expect with these. And that is it for our antipsychotics. One that just kind of talked about in our list, risperidol, can cause prolactin, increases in prolactin. And so in women, it can cause milk production. In men, it could cause them to grow breasts. So, side effects of antipsychotics kind of go all over the place. What we're going to talk about next are anti-anxiety drugs. Like if you're growing breasts, you may become anxious about that.